Demographics is the study of specific populations. We use population health data and demographics to shape the healthcare delivery system. This is to ensure our treatment approach and programs are meeting individual needs. Population health data is information related to the health outcomes of specific groups of people. Some examples are nations, communities, ethnic groups. Population health data can include groups such as employees, individuals with a specific disease, and disabled persons. Populations have also been categorized by race, gender, income, and education. Determinants of population health data can include physical environments that cover a wide range of people, such as medical care systems. Social, physical, biological, and geographic environments are also factors in the study. Changes in the composition of a population over time are important to understand. This will impact decisions on how health care is delivered. Three key components of population change include birth, death, and migration. Migration is the movement of populations between different regions. This can drive a shift in how and where services are needed. For example, as elderly populations move from a colder climate region to warmer climates, the number and types of services available in the warmer region will change. Longevity is also a factor in demographic change. For example, if we see lower birth rates, lower death rates, and greater longevity, we understand that our population is aging. The healthcare needs of an aging population that is living longer are different than a younger population. Population and demographic data is collected in many ways. The U.S. Census, which is conducted every 10 years, is a primary source. Data collected at the individual level, as in a physician's office or hospital stay, is aggregated. It can be analyzed at the population level to test healthcare trends in use in clinical outcomes. The collection of demographic data is used to deploy relevant treatment plans that incorporate race and ethnicity. For example, certain cardiac medications, such as ACE inhibitors, that treat hypertension have been proven to be less effective for African Americans than other classes of medications. Through the use of EHR and other data reporting mechanisms, we create a standardized process for collecting this information. Physicians and health systems can use this information to ensure all patients get the best treatment outcome. Another aspect of demographic data and population health is studying populations at risk. This would be all the people in the same population group who could get a disease or condition. The incidence of disease counts the number of new cases occurring in the population at risk within a set period of time. For example, in a month or a year. This data element describes the extent to which people in a particular population get the disease during a set period. It is useful in estimating the significance of conditions of a short duration. If you see declining levels of incidence, this means your health promotion and disease prevention efforts are working. You have prevented new cases of the condition. In conditions that appear fast and grow large, the incidence could reflect an epidemic. The prevalence of disease determines the total number of cases at a specific time in the population. This data element is useful in sizing the significance of conditions with long durations. For example, chronic conditions like diabetes and heart disease. If you see decreased prevalence, this means your treatment programs are working to shorten the duration of the disease. These broad measures of population health are used to change how healthcare is delivered and the treatment programs. Data associated with demographics includes morbidity, which is the measurement of the frequency of a disease condition in the population. Mortality uses death rates as an indicator of population health and can vary by age, sex, race, or disease. Activities of daily living, ADLs. This is the ability to independently perform basic functions such as washing, cooking, and mobility. Life expectancy. This is the basic measure of health status. which is the statistical average time a person is expected to live. Other demographics and individual preference that shape healthcare delivery include aging populations. This shift will place great demands on the nation's healthcare system. The healthcare workforce could be too small and ill-equipped to meet the needs of the growing aging population. Racial diversity. Each population group has socioeconomic concerns. Lack of insurance or less access to health services, for example. Predispositions to specific diseases. African Americans face higher maternal mortality and are more likely to develop diabetes than whites. Latinos are far more likely than any other population to face lupus. Cultural and religious diversity. In some cultures, for example, a male physician won't see female patients. Other cultures have complementary and alternative remedies that, when combined with traditional medicine, could have harmful consequences. Elderly, vulnerable populations, and people with certain high-cost health conditions present different needs. Studying the use and cost data for these populations is important in developing the infrastructure to deliver care efficiently and affordably.